90, and folks are going to line up at Burke and just drive on by and say hello as she sits on the porch.
We are now on YouTube.
Oh, okay. Talk to you later, Mitch.
All right.
No fanciful background today, Peter?
I thought I'd change around, make sure y'all are paying attention, and you know, I do keep a clean office from time to time.
Great job yesterday, Councilman Brady.
Oh, thank you.
Hey, everybody.
Hey.
Hey, Mayor.
Hey, Mayor.
All right.
For some reason, my main video screen and computer aren't working. Just working off the laptop here. Everybody hear me okay?
Yep.
Yes.
All right. Terrific. So we have the witching hour. I guess people are still signing in. Councilmember Waring made it. How'd that test go? Everything going okay?
I don't think.
He must be muted.
I think he's muted.
Yeah, I'm still in line waiting to take my test. There's a bunch of people here.
Yeah, gotcha. All right, so I think looks like most everybody's on board. I'd like to call this meeting, emergency meeting. There's somebody maybe could mute their phone or their Zoom. That would be helpful. So I'd like to call this meeting to order, June 25th, emergency meeting of Charleston City Council. Madam Clerk, would you please call the roll?
Yes. Councilwoman Del Chapo. Here. Councilmember Shealy.
Here.
Councilmember Saccharin. Councilmember Saccharin. Councilmember Mitchell.
Here.
Councilmember Brady.
Present.
Councilmember Gregory.
Here.
Councilmember Waring.
Yeah.
Councilmember Seekings.
Here.
Councilmember Shea.
Present.
Councilmember Griffin. Councilmember Griffin. Councilmember Appel.
Here.
Councilwoman Jackson. Councilwoman Jackson.
Don't see her.
Muted.
Mayor. Here.
She's here.
Okay, she's here. All right. Mayor Tecklenburg.
I'm here, and Councilmember Griffin is here as well.
Okay, great.
He signed up.
What about Councilwoman Del Chapo?
Yes, I'm here.
Yeah, she was here. She said here.
Okay, I didn't hear.
I think-
Councilmember Saccharin.
Yeah, Saccharin is the only one we're missing right now.
Okay, all right.
I'll let you know if I see him,
Okay, great, thanks.
so to speak. So thank you all for coming together. We needed to have a little more in-depth discussion and some action taken on matters regarding COVID-19. We've all seen the reports lately as to the alarming rise in the number of cases. And Madam Clerk, I do see Councilmember Saccharin coming on.
Great, thanks.
So
We're all here.
We've seen the alarming rate of increase of numbers, and if you extrapolate those numbers out, even over a 4 or 5 week period, it's really alarming the impact that may occur to our medical care system. So I've got a special report tonight. We'll hear from Dr. Robert Ball, an epidemiologist with Medical University. But first, Doctor, if you don't mind, we'll allow either Tracy McKee or Shannon Scaff to give us an update on our city numbers.
Good evening, everyone. I'm going to share my screen here briefly. And I'm on the wrong screen. There we go. So really quickly, we got our new numbers from today, or from yesterday's numbers already. We are in the city of Charleston, at least in the zip codes in the city of Charleston, we are now over 1,200 cases of COVID. And we added 95 with those numbers that were added today. 3 of the last 4 days, the number of new daily cases has exceeded 100. And you can see that on the graph that's in the bottom right-hand corner here. And that growth rate, and you'll see here's the calculated growth rate, which is how quickly the virus is spreading. That just continues to climb. And this is the 7-day, it's a rolling 7-day average. So because the daily fluctuation is so volatile, try to, get that noise out of the data, if you will, a little bit and smooth that out a little bit so we can better see trends. And clearly still, even with that, it's a pretty steep incline that we're on. And really at this rate, we could see the number of cases doubling in 5 days. That's the kind of track that we're on right now at the local level. Of course, most concerning is the potential impact on our hospital resources. And so that's really the most pressing thing to be concerned about. I'll scroll down just a second so you can see that this is the daily number of new cases in our Charleston City zip codes. So you can see that that trend is alarming. And just really quickly, I mentioned employee cases the other day, and I mentioned that they were also on the rise. I just wanted to give everyone a really quick overall number on those. And thanks to Jan Park, our wonderful, amazing wellness coordinator who has done all of our contact tracing and just done a fabulous job working with employees, trying to keep everyone safe, she and the whole safety team. But number of employees, we actually have 29 active cases right now, and we have another 55 that are waiting on test results. So I just wanted to share that with y'all. I do have information on testing. I know Councilmember Gregory had asked about that the other day. He and I had a little off conversation before the meeting started. So he's got all the details and we're getting that information distributed, but I'd be happy to take any questions, but I really wanna let you all hear from Dr. Ball, our wonderful guest tonight.
All right, so if I may intervene one more time and just for further introduction, let you know, many of you know Dr. Ball. He's a 7th generation Charlestonian, by the way, and graduated from the College of Charleston, got his medical degree from the Medical University and a master's in public health as well. You might not have known that he directed Army Emergency Department medical for 2 years during the Vietnam War, and the first physician to diagnose and report AIDS in South Carolina. So he's got a storied and impressive career in medicine and in infectious disease specifically. He's been a volunteer member of our COVID-19 task force. Dr. Ball, thank you for your service and your advice to the city. So we'd love to hear from you.
Thank you very much, Mayor John. I hope my voice is coming through okay.
Sounds good.
It is.
Very good. Thank you. I shall be brief. The trajectory that Tracy showed is indeed an average scenario. Most of us in the infectious disease division at Medical University think that the worst is yet to come month after month after month for a number of reasons. One set of reasons having to do with the virus, the other set having to do with human behavior, which is what you all are thinking about tonight. The virus is far more transmissible than we ever imagined it back in February, March, and April, and has an incredibly higher attack rate and a short incubation period between one person to the other by respiratory droplets. The touch component is minimal, but is real. So wiping off doorknobs, common touch surfaces makes sense, but the big push is for masks. And it matters not, and I understand there is an issue or someone had a question about types of masks. Medically, they are now able to obtain the so-called N95 masks, which are very tight-fitting, have to be tested for sealing and make sure that they are tight around the nose and mouth. But cloth masks that we see nowadays, as so many people making them, also work but only to a limited degree. Above 50%, yes. 90%, maybe. 95%, probably not, but a high degree. There are three purposes in mask wearing, which is, I understand, one of your agenda items. Number one, to protect you from someone else, because 1 in 5 people who have this virus are shedding it when they talk or cough, even worse, when they're shouting. And crowded bars full of young people who ignore common sense, when they're shouting over the noise in the bar, they are spewing constantly virus, some without knowing it. So masks serve the purpose of preventing you spreading it, others, preventing others spreading it to you, and they serve a third purpose. Keeps you from touching your face often. It's a reminder. So masks make perfect sense. The social distancing and hand washing still apply. And until we get a mass vaccine next year and mass public acceptance, that's going to be another uphill battle. We are in for month after month of, shall we say, worsening scenarios. We've already seen the effect of graduation parties and maskless get-togethers after school was out. Then the Memorial Day effect, add to that the riot effect, masked, unmasked people. Now people are, the summer cabin fever effect, get out in the summer. And most of this has to do with going without a mask indoors. When you think about outdoors, you take a walk on the beach or down the block, you don't need a mask. So when we talk about the 6-foot distancing and wearing masks, that's mostly indoor. So you add that together and it keeps rolling like the waves at the beach. We've had our first big wave. We're in our second wave right now, although some experts are beginning to get away from the thought of waves and just thinking of this as a continuum with some fluctuations and surges like where we, Texas and Florida, are experiencing now. And then we have to deal with Independence Day events and 4th of July parties, and then return to school in August. Lordy, I hate to think what that's going to result in. And then Labor Day parties, and then fall events. You get the picture that we are faced with a year of ascending events that are going to simply increase and accelerate what data Tracy was showing, because these data are not only hard facts, But we have to realize that some people don't believe in science and hard facts. And that is the uphill battle of getting the public to agree to wearing masks and not crowding. So if you had to ask me, Doc, if there's one thing you could do, it would be require people indoors to wear masks. Walking on the street without a mask, that's going to be hard to enforce. But indoor mask wearing and limiting the size of crowds, particularly in bars, is, I think, going to be your low-hanging fruit. I will stop there and answer questions.
Any questions? Councilmember Shade?
Dr. Ball, this is Peter Shea. And first, thank you for your service to our community and your family's long line of service to our community. We appreciate what y'all have done for us. And sort of the last thing that you had mentioned about bars and things. And so one of my main concerns was at a restaurant recently. The servers were wearing masks, but here we are, and you can't eat with a mask on, obviously. But we are in a confined area while we're eating or having a drink at a bar or something like that. Are our distances enough in these enclosed facilities such as a bar and such as a restaurant that maybe we need to extend the distance requirements more, or are we doing enough with that? Because we can't wear a mask when we're inside a eating establishment.
Excellent question, Mr. Shade. And the answer is increasing the distance will help some, but requiring outdoor only dining may be a wiser move, because restaurants have now gotten used to the idea of separating tables by 6 feet or more. For the first time since all this started, my wife and I went out and we sat at a table outdoors, had a lunch, and there was no one within 10 feet of us. So what you're asking makes sense. It will be hard to enforce, but enforceable indoors is the low-hanging fruit. Outdoors, less of a worry. I hope that answers your question.
It did. Thank you so much.
All right, any other questions for Dr. Ball? Dr. Ball, thank you so much for being with us. And again, thank you for your service on our COVID-19 committee and in our community. So, and Tracy or Shannon, did y'all have any other information to add, or we're good?
No, I'm good. I'm happy to entertain any questions if anybody has any.
Right. So were there any questions for the information that Tracy had presented prior to Dr. Ball's remarks? Councilmember Shealy.
Thank you, Mayor. Tracy, do we know the hospital capacity right now? Is that going up or staying the same at this point? Do we know?
So a couple different sources for that. I did check the DHEC hospital page before we got on this meeting, and they're showing the Low Country in general at 75% capacity. And you know, we've been in regular communication with MUSC, and Dr. Cole, I think as of yesterday or the day before, made the comment that they're not in an emergency, but their numbers are going up. So they're concerned, but not in an emergency state as of yet.
All right, thank you.
And Councilmember Shealy, they had also checked around with Roper and Trident Hospital and the other locals, and the trend is the same with all of them. That they can still handle it, but the numbers are significantly higher than they were a month or 2 months ago, and the projection of where this thing is going with the increasing number of cases, it's mollified a little bit maybe by the fact that a higher percentage of the new cases is now younger folks, and they tend not to be hospitalized. But still just the overall increase in numbers is going to get us to a point in 4 or 5 weeks time where they would have a pretty serious overload.
Okay.
Would you agree with that, Dr. Ball?
Yes, sir, I would. Currently, the medical university is near 60% ICU capacity with only 8 people on ventilators, but they have 4 dozen or more confirmed COVID cases and more the wings waiting. Same thing with Roper St. Francis, about 60%. When they get to 80% capacity, then I believe Dr. Cole will probably declare a serious situation there, not an emergency, but serious situation enough to begin limiting other services there. So I fear we'll get to 60% hospital capacity probably by July or August. Now, we know that the death rate percentage-wise is only a small fraction of the total number of cases, both confirmed and suspected. And the better news there is that the state has received through DHEC a drug, remdesivir, and we know also about steroids and other drugs that can help save lives. But what your intention is to prevent the infection in the first place, which is great public health, for which I applaud you.
Well, thank you. All right. Any other questions for either Tracy or Dr. Ball?
Mr. Mayor, I think Councilmember Saccharin has his hand up.
Councilmember Saccharin.
Thank you, Mayor. Quick two-part question. One is, as the cases begin to increase, I've been getting calls for a consolidated place on our website. I'm not sure if it's there for testing sites and locations. A lot of the restaurants, their F&B workers are going to get tested. They're getting long lines, and then the response time on the positive negative result takes a while, and that just kind of exacerbates the challenge. Is there a place on the website that we can direct folks that have all the testing sites available so we can kind of push that information out for y'all?
Absolutely. DHEC has a site that keeps that information updated regularly, and that was on our game plan tomorrow to actually work to put that link on our city website, as well as any other resources we're aware of. Yeah.
Thank you.
You're welcome.
DHEC now, but we'll put a link on ours as well. And so the delays in getting a test done and getting the results is also just a factor of the number of cases going up pretty dramatically. All right, so if I may suggest, we've got numbers 5, 6, and 7, which were on our agenda the other night, and they are simply to continue our state of emergency and the other emergency ordinance that we had in place, still have in place, and make sense for us to extend. I think they're written up to extend just to the middle of July, which we'll meet again on July 14th, and we can extend them again at that time. I kind of presume they'll need to be already, to be honest with you. But I thought we'd take 5, 6, and 7 together.
I'll move.
Second.
Yeah, all right. So any discussion about 5, 6, or 7? Hearing none, all in favor, please say aye.
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 Any opposed? The ayes have it. Councilmember Jackson, do you recognize?
You're muted, Carol.
When we send out the information about having extended this, can we make sure we emphasize that it doesn't apply to the plastics ban? I think there's going to be some confusion about that. So and it's very important to people in the community.
Right. So the action we've just taken does not include an extension of forgiveness, if you will, that we've had in place for the last few months on the plastic bag ban. So effective July 1, the plastic bag ban is back in effect, back in place. And I assured folks the other night, and I'll do it again right now, that we'll give businesses a few weeks, the month of July, to let their inventory of other, packaging that they've now got on hand so they can replace it with the appropriate packaging. We're not going to run out and jump on anybody, but officially July 1, the plastic bag ban is back in place. Thank you for pointing that out. So next we have up an emergency ordinance requiring persons to wear face coverings or masks in the city of Charleston. And
So moved.
Second.
To approve and a second. I would like to add, we made some modifications to it late this afternoon to you. Most of those were more thoughtful exemptions. The state municipal association of cities, municipalities has now put out just late this afternoon, a template for a mask ordinance such as this. So we read theirs this afternoon and thought they had some good thoughtful exemptions and ideas in there. So we added that. I would also like to just focus or let y'all know that the focus of this ordinance is on education and compliance and not on enforcement, as our earlier COVID-19 related ordinances have been, is trying to get everybody to cooperate. We want to work with our business community to put this in effect. We will help them with marketing and signage. In fact, Meg this afternoon came up with this sign that we'll share with businesses from the city of Charleston saying, welcome, face coverings required. The city of Charleston requires that a mask be worn while in public spaces to stop the spread of COVID-19. And it makes it clear to customers that it's not just the desire of the store owner, but that this is a requirement of the city of Charleston. So we'll be working with them. We also, there are a number of programs going on that will continue and expand, like the CVB is providing masks for hotels to give to visitors, and CARTA has been giving out masks to anybody that gets on a bus that doesn't have one. So we're going to work with businesses and try to make masks as available and as least expensive as possible. So that's the focus of this going forward, and I would appreciate y'all's support on it. So I will open the floor if there are any comments or questions. Councilmember Jackson. You're on mute again.
Thank you, Mr. Mayor. I think I'm probably particularly sensitive to our neighboring jurisdictions. Since out here on James Island, people can't tell which store is in which town, city, or even unincorporated county. But I did hear from, so the town of James Island, I think, will be considering a similar ordinance. I did hear from some residents that evidently the county council had an emergency meeting this afternoon, and they are still staying with the only recommending to people that they wear masks. So I do hope that we're going to do some sort of more proactive outreach as the city in order to encourage our colleagues on the other jurisdictions' elected bodies, that we all get together and make this a uniform move. Otherwise, people are, rightfully confused. Hopefully they're going to be conservative and err on the side of wearing a mask, no matter where they are. But I do feel like that could be our obligation as sort of, one of the larger jurisdictions in our region. And I know we're part of one region, but again, I do feel like we would be serving our citizens well if we would take the lead and reach out to people who could make the same decision as we are.
Well, thank you. I've talked to a number of mayors. In fact, I was on that conference call today with mayors from all over the state, and Dr. Bell with DHEC was on that call. And she made it clear that there's only a couple of things that we even have under our control that we can try at this point to limit the spread of COVID-19. Because y'all, we want to support businesses. We want to keep them open. We want them to be successful. And if this virus continues to grow like it's growing right now and impacts our healthcare delivery system, there will be another day in consideration for business closures. And we don't want that to happen. This is the one thing we can do, so to speak, under our control to try to make a difference and keep the numbers down and help businesses be successful again. So, Councilmember Shealy.
Thank you, Mr. Mayor. Councilwoman Jackson brought up a good point, with trying to work together with the county, with other towns, that type of thing. And if we could in the future, if we could do that ahead of time, it might be a little bit better. I know there's going to be a lot of confusion in my district because my district looks like a checkerboard, particularly in some areas. But if we could, before we go to vote, if we could somehow coordinate and talk with those other councils, I think it would make things at least less confusing, and maybe we could, not that we're going to convince anybody or they're going to convince us, but to talk and try to work things out so that it's a little more uniform, at least, or we understand each other, if at all possible. But
well, in fact, Councilmember Shealy, I'll share with you that just yesterday I was on a meeting with one region, which included a number of the other jurisdictions, and there was discussion about this. There was concern from some of the members about the constitutionality of making such an ordinance. We kind of coincidentally, the Attorney General released a letter yesterday saying that in fact this is a constitutional thing that cities may do, and I think by taking action tonight, we'll show some leadership. Everybody's thinking about it, and I know everybody's not in agreement. I think Mount Pleasant's going to consider one at their next meeting coming up first of next week. I've been in touch with the mayors of Folly Beach, Edisto, Isle of Palm, Sullivan's Island. They're all considering similar measures. So we are trying.
Okay. All right. Well, thank you. And I've had several of my constituents reach out to me this afternoon that feel like this is very important. So I want to support this. I had one constituent reach out to me that to ask me a question today, and I reached out to Councilman Shade and just recently to Miss Herdina, but about wearing a mask. Is there any laws in South Carolina about wearing a mask in a concealed weapons permit? Are they able to still continue to have that right and wear a mask?
The right to do what? I'm sorry.
To have a concealed weapon and to wear a mask, will they still have the right to carry their weapon?
My understanding is if they're permitted, that there would be no impact one on the other.
Okay. All right.
Yes. Councilmember Shade, and then Appel.
Yes, sir. Thank you, Mr. Mayor. And coattailing on what Councilmember Shealy and I conversation, I did my own legal research on that, and I could not find a restriction on wearing a mask and prohibiting a concealed weapon permit. But I do want to just emphasize something that you mentioned earlier. My responses I've been receiving, particularly from shop owners around the community, has been very much in support of this. I think they understand the importance of maintaining safe distancing, but also covering faces. This is an important thing for all of us. And as Dr. Ball had mentioned, schools starting back up. So we're getting a little bit of a head jump on this in anticipation of our schools coming back into session. So I would urge all of us to support this. I think this is a very important measure on our part. We want to keep our restaurants and our businesses open. They're going to do what they think they need to do as far as their office hours and their operating hours. But this is going to help all of us, I think, try to maybe slow this curve down, get us back down to that zero net gain that we were experiencing back in April and early May. So I'd ask everybody to support this measure. Thank you.
Thank you. I did mean to send out, earlier I got a email from Mariana Hay at Krogan's Jewel Box, and she must have gone up and down the street. 46 different King Street businesses quickly signed on, asking us to support this, and I think some other business groups have been well. And the timing of it, we set the date back to start next week on July 1st to give businesses a little time to get their signs, to get some supplies if they want to choose to offer masks to their customers who come in and don't have one. And so we give a little period here for us to get ready. Councilmember Appel.
Thank you, Mr. Mayor. And I think this is unfortunately a topic that's back in front of us again, and we got to do it. We have to pass this ordinance tonight. I think it's important. I think it's the right policy. I sort of put the question out to the public today on social media through a variety of channels, and the response from average people was overwhelmingly supportive of this ban. I agree with Councilmember Shealy that coordination with the county and our other jurisdictions in the area is paramount. And I would just comment on that by saying, earlier today, Charleston County passed a resolution strongly encouraging people to wear masks. I mean, if you really just kind of get down to it, the difference between a resolution strongly encouraging it and an ordinance that we're talking about today, that we're admitting we're not trying to become a police state over, we're not looking to make this a law enforcement issue. I think the daylight between those two things is very narrow, if at all, if you really get down to it. And the reality of it is there's a broad consensus that masks work, and masks are the easiest thing we can do at this time to help curb this spread. It's not an all or nothing proposition. It's not, are we going to solve COVID with a mask ordinance? Of course we're not. But can we maybe blunt the effect at the margins? Can we at least slow down this spread, which is going on at an alarming rate right now? We got to do that. We don't legislate in absolutes, and I think that this measure today is a reasonable way to go about achieving a very serious public policy goal. So I'm in full support of this measure today. Thank you.
Thank you. And you bring up a good point that I'd like to share with everyone, that again, the emphasis is on education and compliance, but to the extent we ever get into any enforcement, it will not be done by our police department, but by our code enforcement officers and livability department. Our police department has plenty of other matters to attend to. And so we will not be calling 911 to say somebody's not wearing a mask when they should be, if we ever even got to an enforcement request. That would go to livability. And I just want to make that clear. Councilmember Waring.
Councilmember Waring?
Yeah, I'm trying to. Well, can you hear me now?
We can hear you now. Yes, sir.
Listen, I agree with everything that's been said. In the ordinance, the first issue is a warning. So obviously we're not trying to generate revenue by this. As we speak, I'm doing a Zoom meeting from my truck while I'm waiting to be tested. I was in a meeting on Monday. Everybody had a mask on. Everybody was practicing social distancing. I'm feeling fine, but one of the persons who had a mask on tested positive. So I'm just being on the safe side, and found that out about 2 hours ago. So I'm trying to get a test to make sure I'm okay. So as we speak, this is something that, earlier on we were in February, March, we were talking about flattening the curve. And you know what? The curve isn't flat anymore. And what did we do when we were trying to flatten the curve? Some of the same steps that we're taking now. So I'm in support of it. It makes sense. When you know better, you do better, and that's all we're trying to do. Thank you.
Thank you, sir. Any other questions or comments?
Mr. Mayor, Susan Herdina has her hand up.
Okay, and then I'll go to Brady and Seekings. Susan?
Yes, Mayor. Just want to let you know that we asked the police department to do some quick research in response to Councilmember Shealy's question, and Heather Malloy just sent to me some SLED guidance on South Carolina concealed weapons permits and the wearing of masks during COVID-19. And there is no prohibition against wearing a mask and holding a concealed weapons permit. So that is not a problem.
Thank you, Mr. Dina.
All right. Councilmember Rady.
Yes, thank you, Mr. Mayor. I just wanted to comment. I did similar to Councilmember Appel. I had put out a survey for people that live in my district, and the response I got back was pretty overwhelming. It was around 200 were in favor and about 30 were against. But I did get some questions from constituents about kind of the civil liberty aspect of it. And so I did see the Attorney General's opinion, but I want to reassure people that we are not trying to take your civil liberties away by requiring face coverings. But businesses have come to me, and I know other council members, that they are fearing for the safety of their employees, because while they're requiring masks, people are coming in without it. And so we want to make sure that we're protecting public health. My wife works for MUSC. They're opening another COVID unit. And the last thing that we want is for our frontline workers in the healthcare industry to get overwhelmed. And so I would encourage my colleagues to vote for this. The same way that we require a base level of insurance for people to drive an automobile, the same way that we require seatbelts, this is a similar thing where we're trying to protect public health and do what's best for our citizens.
Absolutely. Thank you, sir. Councilmember Seekings.
Thanks. Thank you, Mr. Mayor, and thank you for all of this. I agree with what everyone today has said, all my colleagues. One of the things that I would encourage everybody to do after we pass this tonight is to lead by example. As this came up on our agenda and as we've been thinking about this in anticipation of tonight's meeting, I certainly, like everybody else, have been contacted by a number of people, many of whom observed that at least for a few moments while I was in Marion Square the other night, I did not have my mask on. So I can assure you, there you go, Mayor, well done. I can assure you that we'll be looked to as leaders on this. And to those who are sort of a little agitated about this, this is something that's been asked for by our community at every corner. And the whole objective is to get us back to a place where we can be successful sooner rather than later. I did very briefly, Mr. Mayor, just take a look at the King Street corridor, the economic impact of the King Street corridor in just retail sales in any given good year. And it's about $500 million. And it is that corridor that's asking us to do this so they can get back to business, so we can stay in business as a city. So I encourage everyone who's on this call to vote in favor, to get your masks ready to go, as you all have done as I've been speaking, to wear them when you're out there, and encourage others to do it. I do liken this a little bit to the smoking ban. I don't think we've ever given a ticket for someone smoking indoors, but I can't imagine someone doing it and not having people come up to them and ask them very politely to not do that because it's something we're just not doing in the city. I think the same will be the case with this masks, as long as we have this requirement out there, that there will be gentle encouragement from everybody as a community to do the right thing to make us healthy and well and get us back on our feet again. So thank you.
That's right. Absolutely. Thank you. Councilmember Gregory.
No, I'm fine. I'm lining up, Mayor, for the party.
Oh.
With his mask on.
I'm in the car. Okay. I'm
All right.
ready to vote.
Any other comments or questions? Hearing Councilmember Griffin.
Yes, sir. I am going to vote no tonight. I'm not going to ask our citizens to have any more enforcement or oversight until we give transparent answers of what happened to our city on King Street on May 30th. So I'm voting no. I'm not going to put any more regulations on our citizens until we get some answers on what happened that night.
All right, sir. Thank you very much.
Mr. Mayor, just for the record, was the motion for the amended ordinance?
I made the motion and it was for the amended ordinance.
And I think I seconded.
Thank you.
All right. All in favor, please say aye.
Aye.
Any opposed?
Aye.
Nay.
So is it just one?
I believe so.
Councilmember Griffin? Okay. Thank you.
Thank you very much. Anything else to come before us this evening? Councilmember Waring.
Mr. Mayor, I do have one thing that you can share some information later on, not on this meeting, but I saw where the General Assembly voted on, I think, 1.2 billion of the monies out of Columbia, out of the Capitol.
Right.
And I just wondered if you can share some information later on, not on this call, but you didn't know the question was coming. How much of that would be coming to Charleston and obviously how it would be applied?
Right. So we did an estimate and sent to the state about a week ago or 2 weeks ago as requested. And it only included allowable expenses like when you buy masks or if you had overtime specific to a COVID-19 related matter. And so to be honest with you, our direct expenses have not been over the top, maybe a couple of $1 million. And then we had proposed, it was really basically a grant request to have some additional funding to help our small businesses. But I'm not sure they're going to reimburse us, but for the things that we've actually had a cash expenditure for so far. So at this point, we're going to prepare our reimbursement request and send it up to Columbia. I think it'll be a little over $2 million.
Okay, well, thank you, Mr. Mayor.
All right. So y'all have a great weekend, and July 4th, our next regular meeting will be July 11th, unless we need to call something before then. And I appreciate your support on this matter tonight. Thank you all.
Thank you, Mayor. Good night, everybody.
Thanks, everybody. Be safe.
Have a good night. Thank you all.
Bye-bye.